Okay. Which of the following medications is most appropriate initial treatment for this patient? Okay. Seems like we're probably going to be in psych or neuro. 55-year-old man is diagnosed with restless leg syndrome after presenting with discomfort and an uncontrollable urge to move his legs at night. He's tried non-pharmacological indications of maintaining a regular sleep schedule, avoiding caffeine, but the system persists. Okay, so it's just a disease, like you said before, treatment, and then what's the mechanism of that treatment? So I think the way I remember this is like opposite of Parkinson's. So if we're gonna do like a dopamine, um, I thought it would be then a dopamine antagonist, or is it the same as Parkinson's? All right. So I'm not sure about the first. I'm not sure. That's what I thought off the bat it would be. Um, and I know SSRIs could be used, maybe because they're used for so many different things. Let's see. Why would I want to agonize dopamine unless it's a different receptor that would slow it down or like fulfill it without the need to move? Okay. I can do what I don't like. I know we're not trying to do that, but something about dopamine agonist just seems correct
Okay, that's your
because
gut,
I
right?
because it's like, yeah, because I just can't remember now. I'm like, is it dopamine antagonist or agonist that are going to cause this? I'm just thinking, I know it has something to do. I remember reading some sort of explanation about this. I just can't
Okay.
remember exactly what it
So
is.
the way I would think about it, if I was in your position, right, you
Hmm.
know that the treatment is some kind of dopamine. You don't know if it's an agonist or an antagonist,
Right.
right? So in your mind, you should be leaning very heavily towards A, right?
Okay.
Because on a test taking strategy, right, you know it has to do something with dopamine. And lucky for you, they only have one dopamine answer. Does it make sense?
Right. Yes.
Right, on a test taking, right? And just saying,
Yes.
right? And if so, that's your gut. So now you're like, okay, is it benzos? I don't remember anything about
No,
benzos.
it's definitely not benzos.
Yeah.
SSRIs is never a bad idea for any of these things, but I don't think for restless leg it's like it's that TCAs I know also have like many uses, but they're sort of phased out. I don't think so. And then the alpha 2 agonists, um I don't think that's just not none of this is ringing a bell besides the dopamine. So I would just go with that because I'm not super
Yeah,
confident. Okay.
exactly. Right. So the dopamine, right? Actually, there's multiple ways to treat restless leg syndrome.
Okay.
Mainly it's a dopamine agonist, actually.
Okay.
Um, Pramipexole, I think, is the main one that you can use, or ropinirole, right? Those are your two.
Yes, the rolling okay, those I
Yep.
remember. Okay.
But benzos, SSRIs, TCAs, these don't actually help restless leg. But first thing you want to check with restless leg syndrome, this is just for
It's iron, right? It's iron deficient
iron,
anemia.
exactly.
Yeah.
Iron
That's what I was
deficiency.
looking for, and since it wasn't there, I'm like, it's not that. So
Yeah. So you
okay.
want to check the iron first because that's easy to fix, right? You just kind
Okay.
of give oral iron supplementation and kind of fix that, and it usually fixes. If not, then dopamine agonist can help. So
Okay.
good.